Good morning, everybody. I'm Dhilip Mohanan. I'm currently working as a speech language pathologist in Neurogen Brain and Spine Institute, Navi Mumbai. Today, I'm going to talk about managing speech problems in ALS and MND patients. Let's first talk about what is meant by ALS or MND. So, ALS or MND is a progressive neurological condition where your upper motor neuron and lower motor neuron degenerates, and as a result your motor neurons will lose its function in the brain and spinal cord. So usually there are 5 to 7 persons per 1 lakh persons in the worldwide, and it's most commonly in men than in females, and ages affected will be between 50 to 70. So the cause is unknown most cases, but there are researchers telling that the gene responsible for that is SOD1, which is in chromosome 21. So let's talk about symptoms in ALS or MND. What symptoms you can face? There is muscle aches and cramps you can face, difficulty walking and tripping, can't able to walk properly or climb stairs, and hand weakness and clumsiness could be seen. And you can also see some kind of a weakness that progresses towards your feet, and also there will be difficulty in breathing, and also there will be difficulty in producing proper speech. Your speech will be slurred and voice will be strained and strangulated, and there can be dysphagia. Dysphagia means there will be a swallowing problem, can't able to swallow solids or can't able to swallow liquids. Whenever they swallow liquids, immediately cough generates. So these problems are faced by ALS MND patients. And drooling, because of the reduced lip strength, these patients can also have a drooling, so which on adequate lip exercise can are able to overcome this problem too. Now let's move. So these are someone who have already faced with ALS and have survived more than the expectancy. Everybody knows this is Stephen Hawking. And some speech characteristics. What in speech mainly it affects is your loudness will be reduced. So the person who was speaking before in a high pitch can't able to speak in the same pitch. And breathy and harsh voice quality. Your voice might seems to be very breathy and also sometimes strained voice and strangulated voice. Your voice will be someone like has strangled, so that type of voice you could able to hear. And they can't able to change the pitch. As a result, they will have a monotonous voice. Their voice won't have any kind of fluctuations. When we express our emotions, how we fluctuate our voice. These people can't able to fluctuate their voice. And slow speech rate. Their speech rate will be very low. They can't speak at the faster rate like before. And hypernasality, this is because of their resonance problem. Resonance means before we know, for example, the ma and na sounds are usually hypernasal sounds. But when these sounds, other than these sounds, for example, pa, ba, whenever we speak unnaturally, then it becomes hypernasal. There is more release of air through the nasal cavity. So even the other sounds also become hypernasal. And sometimes the consonant articulation will be reduced. They can't able to properly articulate some speech. So whenever they talk, they can have a slurred speech than a clear speech. So how do you diagnose these ALS or MND? We can diagnose with electromyogram mainly. So treatment include some medicines and also physiotherapy, occupational therapy, and speech therapy. So how do we go ahead and give a management for these people in terms of speech? So first is respiration. So the main parameter which is affected would be your respiration first. So respiration is the main thing which is responsible for your speech. If respiration is affected, you can't able to, your loudness will be affected, and you can't able to have a proper fluent speech, and you may have some kind of a dry coughs too. So how to improve your breath support? So these instruments you can use. There is a spirometer, which is also available in any medical shops. So using this, you can at least improve your respiratory capacity by inhaling and exhaling air into this machine. By doing this, your breath support will day by day at least try to improve. So that when the respiration improves, your speech will also be fluent and your speech will be more audible, and that is, your loudness will be increased. Next is these are some voice technique. So some people will have a voice problems and also some phonation problems. So for them, first we will start with the MPD exercises. So maximum phonation duration, we say. So in this, what we are asked to ask the patient is, we ask the patient to sit straight and take a deep breath and say ah as long as they can. So during this, we can also measure the respiration and phonation coordination too. So by doing this for each vowel, that is a, e and u, we can able to track the improvements too. For example, on one day, first day, the patient is telling around for 8 seconds. Maybe next week he can able to produce for at least 1 or 2 seconds more, maybe by 10 seconds. So slightly increasing it day by day. So his breath support is also a result of a breath support improvement and also his phonation improvement too. And next is lax voice. Lax voice technique is phonating into a straw. So take a straw and starts phonating, that is, blow air into the straw, and by doing so, your exhalation and inhalation coordination also improves. Next is some relaxation techniques, that is some breathing exercises. Sit straight and take a deep breath for 6 seconds by holding your hand on your rib cage, and you can feel your chest cavity goes up, and then hold it for 6 seconds and slowly release it for 4 seconds. So we say it's 6-6-4, that is 6 second inhalation, 6 second holding, and 4 second release, slowly releasing it air through the mouth. So when you do that, the hot release of air comes out through your mouth. So you could see some relaxation in your laryngeal area. And next is lip trills. Giving lip trills like pa 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 pa, like this type of lip trills you have to start giving for the patients to improve their lip coordination too. And then the tongue trills. Tongue trills are very important because main problem in ALS or dysarthria patient is their tongue will be affected. The motion of the tongue, and they can't able to elevate the tongue and touch the upper part, that hard palate, to produce such certain sounds like ta, da, and la, and ra. The 4 sounds will be slurred, especially ra will be affected the most. So what I would say is, improving the tongue strength also helps them in improving their sound quality, that speech quality, that is the ra, la, ta, da will be improved. So, but how are you going to do that? By saying ra, 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 as long as you can, and la, 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 as long as you can. And third one is mixing up 3 sounds, that is tra, T-R-A, tra, 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 tra. So doing these 3 sounds can able to improve the tongue coordination, and also doing some tongue exercises, that is putting your tongue out and going towards your right and left slowly, how much ever you can, and then up and lower, that is taking your tongue up and down movement. Down movement. So this also improves in the tongue motion as well. And next is circumlaryngeal massage. Circumlaryngeal massage proves to be helpful in relaxing your laryngeal area. So this is done actually by the speech language pathologist. It's not suggested to the parents or anybody else, the patient party. Next is the resonation. In this, what we have to tell is the patients will have a hypernasal. That is, patients who used to talk normally will have, when there is an ALS or MND condition, they will start talking more nasal sounds. Okay, I will come tomorrow. So mostly they will be having a nasalized sound. Even the normal sounds will be more nasalized. So how will you able to overcome that? So first technique will be open mouth approach. So you have to start tell them to sit in a straight position and slightly lift their jaw up, and then start talking more into their focus on the oral cavity, not more focus on anywhere else. Try to give more focus by wide opening of the jaw. Okay, the exaggeration speech. So that should be done. Next is gargling techniques. Pretend gargling, those techniques, and the production of sounds ga and ka. That is repetition of ga 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 and ka 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 ka. So these two sounds has to be practiced so that the hypernasality can come down. So next, for people who can't able to use their voice or speech, we have found a alternative communication device that is known as AAC, that is alternative and augmentative communication. This has two types, that is aided and unaided. So unaided means things, for example, you don't need any other external devices or anything, any boards or something. Just with your body parts you can communicate. One such example is the sign language. Nowadays people communicates more with sign language, but one disadvantage with sign language is only a trained listener will be able to understand your speech. Maybe your family members can able to understand, but they have to also be trained on that. But others can't able to understand the speech if they are not trained on sign language. And moving on to aided communication can be understood by anyone, because if they know the language, particular language, then it can be comprehended by anyone. So it's of two types. One is low tech and high tech. So low tech is some kind of a device where only it's very cost effective. No need to put so much cost into that. Just cost effective devices where just your body parts touching on that will produce the speech. There is something known as high-tech devices where it is more expensive. Mostly the speech generating devices comes under high-tech devices. That means you have to actually just by your eye gaze, that is your eye movements, can able to generate a speech. So the next we'll see on the AAC is the communication boards. So communication boards is a type of AAC where it is of two types. It can either be high-tech also, it can be either low-tech also. Low-tech means you have to take a printout of these type of communication boards where basic communication needed for everyday living things will be there, like for example, I want to go washroom, eat food, like this type of things. So you can either take up a pencil or anything and just point out on that what do you want to tell to the communication partner. For this, your limb movement should be adequate, upper limb movement, especially the upper limb movements should be adequate. And moving on to high-tech communication boards, even though if your upper limb movements are affected, you can also use this communication boards by a laser system. A laser system mounted near your spectacles or simply on your ears can able to project it on the communication board. What do you want to communicate? The laser light points to the thing which you want to communicate. For example, if you want to drink water, it projects onto the drink water. Next is this is also a speech generating devices, which is a high-tech device. So just by typing it, you can able to produce the speech visually and also with sounds also. But before it was only visually. Whenever the person types it, the other person, the listener, can able to see what they want to communicate. But now this has been modified with more speech generating devices. So even when you type it, it cannot be audible. So computer generated voice are being projected. So next is speech generating devices. Mainly the speech generating devices are mounted on iPads or tablets. So these has many applications. There are more freely available applications in the Play Store which you can download, and actually you can try it out in the iPad or tablets. So this is also same. You have to use your upper limb movements to touch to communicate whatever you want. So these are the freely available applications in the internet. So next is eye tracking technology. This is some very useful for someone whose upper limb and lower limb is being affected and can't able to speak also. For them, just this eye gaze movement is being used to communication. How they are doing it is there will be infrared light coming out from the eye tracker from your device. So this light will be reflected in your eyes, and then once again it goes back into the eye tracker. So this eye tracker sees where this light comes from. So when it is coming from the right side, it projects, it thinks that you wanted to communicate on the right side. It looks through your right side. Like that, it detects and produces speech on its own. So this is also a good device, and it also people started using these devices more in nowadays. and it's also available in Neurogen Hospital too, at OBI case. Anybody wants to try out this device can come to the Neurogen Hospital and try out for free. And so these type of devices and giving many exercises, we can able to improve their quality of life in the ALS or MND patients, and able to communicate their basic needs and able to communicate for their social needs as well. And thank you. Thanks Neurogen for giving me the opportunity.